Hi everyone, I'm Dr. Vishnu, your rheumatology faculty at Doc Tutorials, and it gives me immense pleasure and utmost pride to welcome Dr. Prakhar, who has got an amazing rank 71 in the recently. I think we're just yeah. So, hi everyone. I'm Dr. Vishnu, your rheumatology faculty at Doc Tutorials. And like it gives me immense pleasure to welcome Dr. Prakhar, who has got an amazing rank 71 in the recently concluded NEET SS exam. And he's just passed out, and we've been talking about some confusions that he had through the last few days. And I think he through giving his exam through such a rigorous residency and cracking this exam and also getting a very good attempt, giving a very good attempt at the INI. It was a great journey. So, firstly, how are you feeling, Dr. Prakhar?
Sir, the result was a bit of a shock the first couple of days because it's been a very rigorous few months of MD exams, then INI, then SS. So it was a bit out of the blue. But after the initial shock of first 2 days that I did get such a good result, it was a very, very amazing feeling because it's been a long months in the making, this result, hopefully. So
Yeah.
yeah,
So,
a very good feeling and unbelievable.
yeah. So, before I ask you about your journey, etc., our viewers would like to firstly know like about yourself, like from where are you, how your academic journey has been, etc.
I am from Kanpur, sir, and since the last past 12 years, I've been in Delhi for one reason or the other. And my undergrad and postgrad both are from UCMS Delhi, UCMS and GT hospitals from the same place. And it's been a nice journey being here. And besides studies, like I have had so many interests and activities throughout the 10 years I've been here. So it's been a wonderful journey, and I'm looking forward to the further future also.
Great, Dr. Prakhar. And obviously, like through this rigorous residency period, like how did you manage your residency while you having an eye on your SS? Like how were your residency days? How were your MD exam days, and then your SS preparation?
So the residency was very rigorous. The workplace environment was good. The workload was a big thing here. Like it could reach up to 100 plus hours in the first year or so. So it was very difficult managing through that phase. But that is something I chose because I had other options like lighter workloads or TMBs or some other options which people suggested might be easier for SS as an option. But as far as I went everywhere during before joining MD and understood I wanted to work in a general medicine setup because I liked that also. So I understood ki I wanted from the bottom up approach because the top down approach would be easy working in a private setup or the knowing the investigations and having a quick diagnosis would be better and easier for me. But in the long run, I needed to build from the ground up. So that was a very tough building phase in the initial part, but you stabilize and then it helps you see things very clearly in a lot of chaos, and there is a lot of chaos. Even the NEET exam, not just the wards and everything, the exam was chaos also. So I guess that residency builds that character of strength for me. And then in the final year, sir, around 6 to 8 months before the MD exams, preparation was amped up after thesis submission and all. And preparation wise, sir, I there was no one source. It was a lot of big learning through 3 years because we are encouraged during ward rounds, during emergencies to use tools like up to date articles, notes, and the common cases, the uncommon cases. So I won't say ki I ever just has a base of Harrison or one particular notes. Obviously, the doc tutorial notes and guidance helped a lot to form a thesis, but it took multiple angles to the same disease to understand ki, okay, I have there's so much going on in the world that we might not be able to see in the same hospital, but that built up a multiple source kind of thing in our mind ki I don't know where I know things from, but there was such a wide base. And then covering through and through Harrison and besides the system, the non-systemic chapters, environmental illnesses, the genetics, the updates, the ethics, they were so important, and I gave them so much time, dermatology, psychiatry, other subjects, because I was sure ki even I am pursuing MRCP also, so I wasn't sure ki which part would be useful to me as a clinician also. And during the last 6 months, I also realized these might be the last few months I have as a MD general medicine physician for life. I might pursue a specialty, and this is the only time I have to be a good clinician. So I just tried to sap up as I could from multiple sources, including definitely, and it was very helpful. All of that.
Great, Dr. Prakhar. I think, this particular thing, that these are the last few days of reading general medicine, that is something that very like inspires you a lot, and that is a great way to look at things rather than looking at it as a burden that you are having to study so much. It's like, you took it in a very positive way. And Dr.
Yes,
Prakhar,
sir.
like, firstly, how did you take this decision of giving SS, because that is something residents do, because most of the internal medicine residents want to continue in internal medicine, or be in general medicine. So how did you take this decision of being in SS, and what type of SS you wanted to do, etc.?
So, firstly, I think it has a little bit to do with my background. My parents are doctors. I have come from a host of family of doctors, and my elder brother is also like an endocrinologist from the same place I've been in. So, I look up to them. So they set a benchmark which I had to follow. So, I that was one part of it. Other was ki I felt ki although I love general medicine, I if given the option, I would like to keep being that only. But I saw a lot of things, but I realized that for life I can't treat everything perfectly, and I will not be good at everything. So I had to pick something where and run with it, so that whatever I do, I become better in that as much as I can. Now I have a little bit base of everything to become a good clinician, but to become a good doctor, I think, and for the patient also, I needed to take that further step also. And regarding
And
the
then
sub branch, yes, sir. I decided on that rheumatology. I went through a host of branches, and I don't think there's any perfect branch, even for one person. Because it's so vast medicine, and everything offers a different lifestyle, different level of satisfaction. And during a residency or DM, even it is exciting and fun, but eventually in life, the caseload settles to a comparatively simpler margin, mostly as far as I understood from the seniors who are pursuing there. But rheumatology I like very much because it encompasses medicine a lot. It was like a multi-systemic disease, and it has a very novel approach to things, and it is something which is being understood constantly and evolving. So I wanted to be a part of that journey of rheumatology. So I hopefully will get that chance to do that.
Great, Dr. Prakar. And coming to your preparation, because that's what students want to hear and want to learn from you. So, how did you go about the preparation of SS, be it INISS firstly, because that was the first exam that you gave, and then coming to NEET SS?
Yes, sir. INISS, sir, firstly, the important thing, first focus for me was INISS because if I did not have a branch, INISS would not have been feasible to give. And INISS was just a month after my MD exam, so I needed to be clear about that a year in advance, or at least 6 to 8 months in advance. So I took some stock 1 year back and decided on a specialty because people do have that difficulty, and that makes it difficult to stick to one subject, especially for NI. So that is the very important thing, I think, to take some stock and decide after second year at least what do you want to do, so that you can spend some time with the specialty book of your preference. So then, entering the third year, I gave 2 to 3 months to Kelly's. First read was entirely different, and the next couple of reads, I didn't even realize what I was reading the first time. So it took a couple of reads to just understand what the subject encompasses. And then I did that, then switched back to general medicine a lot for my MD exams, and that was a very wide source because again, as I said, Harrison, up to date articles, you just have to keep reading updates. You cannot stop and think this is an important sector, because you don't realize after so many exams ki everything is important. So I studied from all those sources, and doc was definitely a good base. Then after my ND exams, 1 month I diligently followed your videos, your WhatsApp groups, everything. I stuck to everything you said. We have to study Harrison, Kelly's, every flowchart, everything, and it was very much helpful, sir. Because it was like someone was holding your hand through the tough journey it was. And although I did not I got a decent rank, but that did not help because rheumatology has a paucity of seats, only 3 to 4 seats on average every INI. So I was ready to go again for that. Then reeling from the disappointment, NEET came again in around 1 month. In the last 20 days I had, after the disappointment and everything, I then focused on a few things. One was 10 days I took for the QBank, basically elite series of doc. Every day I did 200 to 250 questions from all the subject, mixing everything. And besides that, QRP, that was a big help. I did QRP through and through from every subject from starting to end, and then just consolidated a lot of things I had in my mind and some things I didn't have. And for the final 10 days, I basically switched to Harrison, and I had the latest edition, and I covered it front to back, every single table, every text, subtext, not the main text, but tables, diagrams, and subtext. And the chapters beyond the systems I read fully, like environmental illnesses, toxicology, genetics, all that. I revised fully, and I guess that helped because the paper was one third almost of those chapters only. So that Harrison QRP and Elite series was my last 20 days because I didn't have a lot of time. And mentally, I was not in a mind frame of NEET also. I was like, yeah, I'll have to drop, and I was going for the next INI basically. But then I realized on the exam day, mostly it was just medicine. It was not something special that you need to clear for. You need to bring into life the last 2 3 years of your life, and they just come up on that day. So there's no shortcut. I think it's 2 3 years in the making, and beyond that.
Definitely, Dr.
That's it,
Prakhar.
sir. I
And
think.
yeah, I think, and you used a principle that we usually tell, that Pareto principle, where you had limited time because you were giving your MD exams as well. So you use the highest yield sources, like you used our QRP and elites, which I feel cover at least 80% of your preparation while taking only 20% of the time. And same with the
Definitely, sir.
INI. Yeah, same with the INI also, you use the PYQ, because INI there's a lot of repeat topics compared to NEET. In INI there's a lot of repeat topics. So PYQ and
Definitely,
PYQ
sir.
based topics is the most important part of that. And also the QBank and the tables flowcharts videos that you used. Great, Dr. Prakar. And other guidance that you'd like to give juniors, because one thing is that there is always a confusion with INI versus NEET, especially in the this November phase. So that is one thing. And other thing is how to navigate residency and your SS prep. These two things juniors usually like to know from you.
Sir, 6 months back, I believed ki these are different preps, and these are to some extent the last month or so. These are different preps every exam, because every month I had an MD exam, INI, NEET, and even MSRPP. So 4 exams in 4 months. Every exam and a different approach, but the fundamentals remain the same. So I believe you have to stick to the fundamentals. Harrison is a must. The bare minimum is you should have seen every flowchart and table of the book, and you should be familiar with everything like that. Beyond that, it's a mix of sources. You can doc tutorial. I think every faculty is wonderful, and you wouldn't go wrong in any subject you go delve into that. And you cannot skip subjects that one subject or two subject has to be weak, because this year's papers proved that it can go in any direction. So you need to take a big approach, and then hopefully some bit of luck works out on that day. So I think you should, and the even the wards and emergencies help so much. In the on the exam day, I felt ki someone was taking a ward or emergency round, and they were just asking me ki this is the patient, what will you do next? Almost 100 times felt like that answer. So I think that working so much diligently, almost without 5 to 10 leaves per day, I think that helped in a daily basis. That little questions just built up a persona, I think. So you should do that every resident. I feel ki maximize it to the fullest. And then regarding INI versus needs, I am not even sure. Even now, I understand the fully the balance. But what I did understand was that, especially in this branch rheumatology, there is such a paucity of seats, only 3 seats. Even on your best day, you might secure a rank 4 or 5 or 6, and then have some disappointment. And still, that doesn't make you a bad clinician, or even make you not lesser than the other person. But so you just work towards it, and it is a marathon, not a sprint race. So there are exams every 6 months, every year or so. You just keep working towards that, and every college has something different to offer. There is no perfect college, neither PGI, neither AIMS. Every friend I have in a different specialties, there's no perfect thing. There's a complexity of bonds. There's a complexity of the work you will have, the work-life balance. So you whatever you get, you will find some good in everything. So even at this rank, I have to figure out what is perfect for me, DM, DNB, or which state. Everything is a big challenge. So you just run with it, study your best, and once you get the rank, you'll know that when a time of reckoning comes, what you have to do. And one other thing I feel is ki I took very frequent breaks. Like last 6 months, I think every month I went to see a movie or went out every week. Sorry, not month, every week, because exhaustion is a big factor. Not for everyone. There are people who can go the distance, but I thought ki I'll burn out, so I have to keep going for maybe 1.5 years. So I just took a day for myself, and the rest of the 6 days I kept studying very nicely. So breaks are a very must, whatever suits you, but you don't have to study all the time. That just I think creates more difficulty for you.
100%. And if you're just going on and on, it also affects the quality of the study. It's not just about the hours you put in. No, it's said that it's not the hours you put in, it's what you put into the hours. So
Yes, sir.
great. I 100% agree, Dr. Prakar. And coming to your rank, obviously it comes to on your efforts, on your shoulders, but also there will be a support system around you that helped you through this journey. So, whom would you like to thank through all this?
So, firstly, my parents who've been wonderful through the entire 9 to 10 years, not just that, before that also, but last 10, 12 years, which have been long, they've fully absolved me of any responsibilities of being an adult. Ki you just go and run wherever you want to, and we are there. There was a shoulder key. I don't have to worry about falling or stopping to breathe. I could have just made any level of mistakes, took my time, and gone there. So there was that constant, unending support, and them being doctors was an additional thing that they understood the task at hand. Then I had elder siblings also for the same that they again helped me through tough phases. And you need people to talk to, because this is a never-ending phase. It won't end even for 3 after 5 years also. So you need people to help in that. And my co-PGs and my friends, that co-residents, there's a big support system that every day in the ward just survival. It's survival on some days, and those friends are I think valuable for life.
Great, Dr. Prakhar, and we'll always obviously keep in touch till the time you join. I think, and even after that, also we'll
Sir,
keep meeting.
sorry I'm stopping you, but definitely the one person I forgot to thank was you, because I think you started my journey into this branch, and 1 year back I figured out, and you've been an inspiration throughout all this. And I don't think I would have. Rheumatology is a very high benchmark for me personally, I feel, because it's so difficult to study and to aim for. And I think just seeing you and seeing you speak and talk, and it just gave confidence every day slowly to even try to achieve this. I wouldn't have even gone there. Mentality is half the game. And I think you, besides the wonderful teaching you do, that's something you've done wonderfully to just get some other person here. And I'm sure you have done that for many other people, and you'll keep doing that.
Thank you so much, Dr. Prakhar. It's just something that we try to help you, and the results are all your efforts. It was great talking to you, and obviously we've been talking through the last couple of days or so, and we'll keep in touch through the next few years and ahead. And all the
Yes,
best,
sir.
Dr. Prakhar. Thank you so much for talking to us.
Thank you so much, sir.